Joining us today for our weekly COVID-19 briefing. Today I'm joined by Monroe County Public Health Commissioner Michael Mendoza. We also are joined again this week with Dr. Nana Bennett from the Finger Lakes Regional Vaccine Hub and the Finger Lakes COVID-19 Vaccination Task Force, and Wade Norwood, CEO of Common Ground Healthcare and also the co-chair of the Finger Lakes COVID-19 Task Force. I again want to thank our Spanish broadcast interpreters and American Sign Language interpreters for providing their services again this week. And our Spanish language simulcast is available on the Monroe County Communications YouTube channel. Just remember, all you have to do is go to YouTube, search Monroe County Communications, and you can find the simulcast right there. So let's start right into it with our metrics, as we usually do, and we can look at the trends that we're seeing in our new case numbers. Last week, when we started talking about the surge that we were seeing in new cases, they were mostly among younger residents. Over the last 7 days, it seems as though we were plateauing, or at least not surging like we were the last previous few weeks. However, we are still seeing far too many cases among our younger age demographics, including primary school age children, young adults, and young professionals. From yesterday's COVID-19 report, we had 35 cases of residents 9 years old or younger, 41 cases of residents 10 to 19, 47 cases of people in their 20s, and 46 cases of residents in their 30s. This has been a trend for the last several weeks. Our local positivity rate has held steady over the last week. Yesterday's reported 7-day average positivity rate was 3.2%. When we held our briefing just last week, 7 days ago, it was at 3.1%. So it's still well above where we were in the middle of March when we hit the low point of 1.5. Our new daily cases have also flattened over the last week, but still remain a little bit higher than we would like to see. Yesterday's 7-day average of new cases was 242, which is actually slightly lower than we were at our briefing last week when it was at 258. So our average, or if you look at the 7-day average, which we like to look at averages, remember, because some days you're going to go higher and lower, particularly around weekends and holidays. Again, if we look back last month, though, a month ago today, our 7-day average was 111 back in the middle of March. So we're still higher than where we were in the middle of March, but we're lower than where we were at this time last week. Hospitalizations in ICU, which we also acknowledge are lagging indicators of the full health of the community, has reached a 2-month high yesterday, with reported 229 people hospitalized in the Finger Lakes region, 58 in the ICU. So we're flattening out a little bit, but our metrics still remain higher than we'd like to see, and our hospitalizations are now catching up to the surge in new cases that we saw beginning over the last couple of weeks. So as you would naturally, I think, see to indicate as a lagging indicator that we would see those hospitalizations rise a few weeks after you see the rise in the cases. So, you know, we think about what do we do about that. I keep saying our numbers are still a little bit higher than we'd like to see them. There's a very simple way to fight this, and there's a very simple way to bring our numbers down. We need to vaccinate. According to the state vaccine dashboard, as of yesterday, 247,000 residents in Monroe County have completed their vaccination. I'm sorry, as of yesterday, 247,000 residents have completed their vaccination series, and that's up from 226,000 who completed their series at the time of last week's briefing. In addition, 344,000 of us here in Monroe County, or 46.4%, have received their first dose of vaccine, compared to 322,000, or 43.4% of residents who completed or who had their first dose at this time last week. So, and we are running above the state average. The state average is 42.6. We're at 46.4. So we're happy to see that we're still running above average for New York State. But what we're seeing here locally and across the state and the country is that we have an abundance of vaccine now. Just as we talked about last week, that we're just at that bubble of having where the supply and the demand were about to switch. We're going to have a lot more vaccine than we had demand to take it. We're right there. And what a difference a month makes. It was just last month that there was this talk of almost this Hunger Games style race to get vaccine appointments, where the appointments were gone online within minutes of them posting. That's just simply not the case anymore. As you can see from this image that we've taken from the Finger Lakes Vaccine Hub's appointment finder, there are a lot of locations and appointments with vaccine availability in Monroe County and throughout the region. And it's not just appointments that are available at the mass vaccination sites where you're thinking about the convention center, the Fleet Center, the State's Dome site, or the Hawkeye site. There's vaccine available right in your neighborhood at pharmacies across the community. Wegmans has a number of appointments. If you just look at the vaccine finder, it updates regularly where there are appointments available. So I would encourage residents to please check out the vaccine finder if there's hesitancy of coming to a mass vaccination site and there's a reluctance to go there, but you'd rather stay right in your own neighborhood or your own community. There is vaccine available to you, and it's very easy to find. Also, to make receiving a vaccine that much easier, as of today, appointments will no longer be required at any of the Monroe County operated vaccination centers for any individual who's eligible to be vaccinated in New York State. This includes the Rochester Riverside Convention Center, the county's Fleet Center, but it also includes all of our community-based clinics and the pop-up clinics that are sponsored by Monroe County. So that includes the 4 clinics that are located in the city of Rochester and the 4 quadrants at the rec centers and at several places of worship. It also includes the vaccinations this weekend at Frontier Field in conjunction with the Rochester Red Wings. Appointments are not necessary. We are accepting walk-ins. But if you do want to plan ahead and make sure that vaccine is available for you and you schedule your appointment, please call 753-5555 and we can schedule your appointment right over the phone. So you no longer need to go online. You're obviously welcome to do so at our county's website, but we're also scheduling appointments right over the phone. That's a 24/7 operation and service. So we're also looking at different ways of pushing beyond the convention center. As you know, we in the Fleet Center and the mass vaccination sites, as you know, we started different locations looking at zip codes where there was low vaccination rates compared to the county as a whole. And we announced those locations a couple weeks ago, particularly in the city of Rochester. But we're also looking to partner with organizations to get vaccine into the arms of many people as we can. So just yesterday, we announced a targeted pop-up clinic in partnership with the Rochester Red Wings at Frontier Field. The clinic will be held this Saturday, April 24th from 10 a.m. to 5 p.m. Again, you're encouraged to go to our website and make an appointment, but we'll also be welcoming walk-ins at Frontier Field as well. So you want to come out, get a look at the ballpark. We haven't been in there in a while, in over a year. This is a good opportunity to get back to the ballpark and get your vaccine. Also, courtesy of the Rochester Red Wings, anyone who gets a vaccine at the Frontier Field Clinic this weekend will receive a voucher for a free hot dog at the Red Wings game this year. So very excited. I want to thank Naomi Silver, Dan Mason, the whole team over at the Rochester Red Wings for working with us to do this. You know, as we start to think about all the great things that we want to be able to do again this summer as we get back to that sense of normal. Now is the time to be thinking of that. You know, if you want to go to a Rochester Red Wings game, we want to get back to festivals, we want to get to, you know, high school graduation, college graduation ceremonies. This is the easiest way to do it, is to get vaccinated now, because the vaccine you take now, there's a runway before it becomes fully effective. As you know, the vaccines we have today, the Pfizer and Moderna, require 2 doses. So you get your vaccine now. If it's Pfizer, you get your second dose in 3 weeks. 2 weeks after that, you're fully vaccinated. Then you don't have to wonder if there's going to be a test available, rapid test, a PCR test, when you want to go and do one of these things this summer. You know you're vaccinated, you know you're safe, and you know you can participate. So now is the time to be thinking about this summer. We're also developing different ways to link community partners into the vaccination effort. The other speakers today are going to talk a little bit more about the national but also regional ad campaign that's going to be starting to roll out over the next several days. But we also want to talk about making sure that as we as a community start to become vaccinated and leaders in this community are vaccinated, we want to start to really talk to our constituents. And I urge all leaders across this community, now is the time to step up and engage with our constituents, engage with our communities, and talk about the benefits of being vaccinated. This can't just be a county leadership-driven effort. We really need to talk to the entire community, the faith community, our public service communities, our Rotaries, our Kiwanis clubs, all of the leadership throughout the community. If you want to get involved, we want you to be involved. We want you to be ambassadors of information and ambassadors to the public to talk about the benefits of being vaccinated. Last year, and I'll close by saying this, last year was one of the hardest years I think a lot of us in this community could have imagined. High school graduations, proms were canceled. The Red Wings lost an entire season. Seabreeze, the amusement park Seabreeze, was not able to open to celebrate the 100th anniversary of the Jackrabbit. But we can return to normal. By getting vaccinated, we can go back to doing all of those things. State guidance that's been coming out has been requiring either a vaccine or a test to be able to go back to a lot of these sense of normalcy and a lot of these activities. Now is the opportunity to get that vaccine so you can go to the graduation ceremony, so that we can go to the Rochester Red Wings and see a ball game this summer, so that we can go to all these festivals that we know we want to have. Now's the opportunity, now's your chance, now is the time to get that vaccine so that we can go and do all those great things, because the vaccine works. When we talk about our metrics at the beginning of the press conference here, I underscored the fact that most of our cases are coming from individuals who are either only recently eligible to vaccinate or children who are still not eligible to vaccinate yet. But those who have gotten the vaccine in the older age groups, it's working. The numbers are low. So I think we should take that as a sign that if we get vaccinated and we get enough of us vaccinated, these numbers will continue to go down and we'll get back to that sense of normal. But we have to do it together. There are over 700,000 people who live in this county. We all need to do our part to flatten the curve, get the numbers low, and get us back outside so we can enjoy each other, company once again, and be a community together. So with that, I'm going to turn it over to Dr. Mike Mendoza.
Thank you, County Executive Bello, and thank you again to all of our partners in the media for joining us here today. I want to begin my remarks today focusing also on our ongoing vaccination program. Supply, as you heard, is beginning to outpace demand across the country, including here in Monroe County. The good news is we have seen a lot of initial enthusiasm for getting vaccinated. About 70% of our older adults have been vaccinated, and we continue to see very low numbers of COVID-19 infections in people over 65 years old. That's proof, sitting right here in front of us. We can see how effective this vaccine is at preventing sickness and death from COVID-19. But even though the light at the end of the tunnel is even brighter now, it's clear that the initial enthusiasm for the vaccine is beginning to wane. A return to normal is possible, but if enough of us get vaccinated, we can fully reopen our schools and our economy, but we aren't yet there. Of the tens of thousands of Monroe County residents who have received the vaccine, no one has experienced severe illness or death. It is safe, it is effective, and it is free. And it is easier than ever to get your vaccination at sites all across the county. In spite of this, we continue to see Monroe County residents hospitalized or dying from COVID-19. This is also proof that we are nowhere near herd immunity. To get there, we need at least 70% of our every eligible age group to get this vaccine, not just our older adults. So please, if you still have not yet received your vaccine, do that today. If you still have questions, I encourage you to call your doctor and get the answers before you go. Please don't wait. The sooner we reach that 70+% mark, the sooner all of this can become a memory. And to all of my colleagues in primary care and in medicine, I encourage each of you to directly reach out to your patients. Our patients trust us. We know our patients. I know you are busy, but I can think of few other priorities more important than this right now. It is our responsibility to step up as professionals and play a role in educating and helping our patients to understand the importance of getting the vaccine. Shifting our attention to ice hockey, we have been getting a lot of questions about when competitive youth ice hockey can resume again in Monroe County. As you know, we have evidence that COVID-19 variants are at play now in Monroe County, and we are seeing our positivity rate trending upward as a result. It is very clear that competitive ice hockey and or behaviors associated with the sport have put players, coaches, and family members at higher risk of COVID-19 than any other sport. Since we took back support for competitive play about 2.5 weeks ago, we have seen another 50 positive cases associated with ice hockey in Monroe County. That is double the amount of times ice hockey showed up in our exposure report for January and February combined, and far more than any other sport. Since that tournament at Bill Gray's, 70 positive cases in Monroe County have been directly traced to that event. Other counties are also reporting that they have seen cases connected to that tournament as well. So while I understand the strong desire to get back to normal, now is not the time to resume this higher risk activity in full. Not if we hope to keep our schools on a path toward full reopening, not if we want to keep our families healthy and safe. So again, let's get through the vaccination process as quickly as we can so we can get all of those things back to normal once again. And finally, turning to the issue of testing, and specifically the at-home test kits that are now available across the community. I am hopeful that this can become an option for those who wish to conduct COVID testing at home for whatever reason. In thinking through how this will work, however, regarding the rules around gatherings, we have been in conversations with New York State, and we anticipate guidance from them on whether any of these at-home tests would be considered acceptable for entrance into a wedding or another large event. It is important that anyone conducting testing reports results to the health department, especially the positive results. Not only is it important for us to learn of positive results so that we can begin our process of contact tracing and controlling spread, but ensuring that all results, both negative and positive, are reported to the county or to the state will allow us to make sure that our positivity rate remains accurate. So like all of you, I am looking forward to hearing more about what this will look like, but for right now, we don't yet have all of that guidance. So with all of that said, I will pause and turn it over to Dr. Nana Bennett.
Thank you very much, Dr. Mendoza. This is week 19, and as you all know, we are facing some challenges this week, one being the one that County Executive Bello and Dr. Mendoza referred to, which is filling our appointments. Another being the availability of Johnson & Johnson vaccine. On the latter, I'll just say quickly that we hope that by Friday, this pause will be resolved and we will have good information from the Advisory Committee on Immunization Practices as to how we should move forward. On the former, with respect to ensuring that everyone gets vaccinated, we really see two different approaches. One is improving access and availability, and you've heard of all the different ways in which Monroe County is doing that. Let me assure you that throughout our region, all of our counties are undertaking some of these same activities to ensure that there are no barriers to access for any of our citizens who wish to be vaccinated. The second aspect is choice. We really need to encourage people to become vaccinated and to dispel whatever myths they still have about our vaccines. And one of those things that we hear frequently is questions about effectiveness, which I can assure you is really very, very high. Another is safety, and we know now that these vaccines are incredibly safe. And the last is the question of cost. We understand that some people have not been sufficiently reassured that receiving a vaccine is free, absolutely free. You do not have to have insurance to get vaccinated in our region. So those access issues all should be removed, but the choice issue remains. And one of the choice issues has to do with who is talking to whom about the vaccine. And as County Executive Bello mentioned, we know that we need trustworthy sources for information in our community. It's not enough for me or Dr. Mendoza or County Executive Bello or Wade Norwood to say this is a great vaccine. People need to hear it from those that they trust in their communities. And to make this a little bit easier, we have developed a toolkit, which is now available on the FingerLakesVaccineHub.org website. And this toolkit will enable anyone to talk to their friends, family, constituents, whomever they wish to speak to about the value of this vaccine. And we hope that this will encourage people to take on this chore, that they will have the talk with their friends and family about why they should get vaccinated. Another tool that we will have in the coming weeks is PSAs, which you will see. There have been national PSAs that have been being shown on local stations. New York State is launching a series of PSAs. And in addition, the Hub and Task Force locally will be launching PSAs. So look for those. They will have good content in them that can be shared. Share them on your social media sites. Please get the word out as much as you possibly can. And lastly, I just want to join Dr. Mendoza in encouraging our fellow healthcare providers to take a major role in this. Healthcare providers are trusted in the community among their peers and among their families and their friends. So please, please have the conversation with the people you know and love. Please encourage them to get vaccinated. It's our only chance of really being able to enjoy our summer. And with that, I will turn it over to Mr. Norwood, who will talk a little bit more about the content of communications.
Thank you very much, Nana, and good afternoon, all. This is going to be one of those opportunities where, as I would say to my congregation on a Sunday morning, I hope you don't mind if I take my time. This effort has moved, as we all know, into a new phase where we really have to start doing the very challenging work of convincing, reaching, informing, and providing confidence to those of our neighbors who were not in the activated stage of taking this vaccine, these vaccine options. And I am incredibly proud of the fact that in readiness for this moment, while our colleagues have been doing all of the hard work on the supply side that we've been sharing with you, not only today, but in advance. And while we have been doing the hard work as a community of engaging in advocacy with the higher levels of government to really increase the amount of authority, autonomy, and flexibility that we can have at the local level, to really design an effort that really meets the needs and the hopes of the Finger Lakes region. We also have been hard at work doing what I believe is equally essential work, which is really understanding that the best experts in how to do this work are the residents of the Finger Lakes region. And as we declared at the very start of this effort, we would be building a work plan that would not flow from some mountaintop down to the community, but rather would be rooted in the wisdom of the community, not just of those trusted leaders that my colleagues have been talking about, but also representative neighbors themselves. And I am delighted to be able to share that preliminary results from more than 250 conversations with folks all across the Finger Lakes region have shown that for all populations, our neighbors trust their doctors most when it comes to making the personal decisions that really lead to moving from being hesitant to being an active seeker of the vaccine. All across the region, we've heard the clear voices of people who have stressed the importance of having vaccination sites that are convenient and accessible, with rural residents expressing a willingness to drive into town, and people of color asking for sites that are close to public transit. Although these things were things that we had intuition of, I cannot overstate how incredibly important it is to our planning process to have this accurate, vibrant, qualitative data that allows us to move forward in evolving how our regional effort will continue to evolve in order to meet the needs of the folks who right now have been the most difficult to reach. We will continue to use these learnings to inform our communications and engagement strategies and to inform the